Oral hygiene is important because you prevent periodontal disease, gingivitis, halitosis, cavities, and much more. Brushing, flossing, and using mouth rinses will also help with these problems. Going to the dentist regularly will also help eliminate those problems as they do a deep cleaning for spots most people miss at home. Today, April 29th, I am with my patient at Olivia's dental office in Seneca, Illinois. We are going to discuss oral hygiene and how we can improve oral hygiene to prevent disease, gingivitis, halitosis, and more. Let's get started. Do you know what other oral hygiene includes?
Brushing and flossing.
Yeah, so it includes brushing, flossing, and using mouth rinses. Do you have any bleeding or sensitivity when performing these tasks?
Bleeding around my gums.
Okay, so brushing is going to prevent the plaque that probably will be the problem of your bleeding, and this forms on the teeth, and plaque has bacteria that will cause demineralization of the teeth. How often do you brush?
About twice a day.
Yeah, so you want to brush twice a day. That's good for you, in the morning and then at night. You want to spend 1 minute on the top teeth and 1 minute on the bottom teeth, equaling 2 minutes total. Brushing in small circles with light pressure using a soft bristle brush will remove the plaque from the outer surface. You want to get in between the teeth too, so what other oral hygiene practices do you think we'd use?
Mouthwashes.
Yeah. So on top of mouthwashes, you can use flossing. This is going to help you get in the interproximals of your teeth, and this is meaning the in-between of the teeth. Food, plaque, and bacteria get stuck in between, potentially causing periodontal disease. How often do you floss, and how often do you think you should floss?
I floss about once every 2 weeks, but I probably should floss every day.
Yeah, so you want to floss at least once a day minimum. When flossing, you want to wrap the string around your middle fingers so you can use your pointer fingers to help guide the floss in between your teeth. You want to wiggle the floss in between your teeth, and then once you have the floss in between the teeth, down by the gums, you want to make a C shape around the teeth so you can get all the food, plaque, and bacteria out. Do you use any mouthwash?
I don't.
Alright, so mouthwashes will help you loosen debris, temporarily eliminate bad breath, or give you a clean feeling of the mouth. Mouthwash is not used to replace brushing or flossing. It is an additional oral hygiene practice. Do you have any sensitivity?
I do.
Alright, so mouthwashes are going to have fluoride, which will help reduce that sensitivity. To use mouthwash, you want to brush and floss how I explained to you earlier in this video. Then rinse the mouth vigorously with 20 milliliters for 30 seconds, and then spit out. You want to make sure you do not swallow. Do not eat or drink anything for 30 minutes so that the rinse can be most effective. And remember, these are just practices you can do at home, but seeing your dentist regularly will also help keep up your oral hygiene.